Investing in prevention is cheaper than repairing lives later. Preventing child abuse and neglect before it happens would cost far less than the $80 billion annually we spend on addressing its long-term impacts.
SNAP, this program has helped countless families within the programs I have worked with for over 20 years. The need for underserved communities to have access to food is dire. Many heads of families have lost jobs due to recent budget cuts or the elimination of specific jobs altogether, so the need for governmental support to access food is vital. To cut the SNAP program will only add to the already stressful situations that many individuals and families, especially children in schools who are part of free lunch programs, are facing, and it's awful to know that this program is at a huge risk.
We have welcomed 94 children into our home in need of a safe, loving environment while they await their forever family. One of the many requirements of foster parents is to provide children with appropriate medical care.
I have adopted 4 children through foster care, each one with trauma that requires therapy. I could not have done it without the support of Medicaid. Foster care cannot exist without Medicaid.
While we were fostering a little girl with increased medical, mental health, and dietary needs, my husband lost his job. There is no way we could have afforded her special foods, medical appointments, and therapies on our own. Services provided through agencies like WIC, IDEA Part C, Medicaid, and Head Start played an enormous role in our ability to parent her during her stay with us.
Fostering and adoption have deeply impacted my family. While financial support like TANF, subsidies, and medical cards has helped, inflation and rising costs have made it harder to manage, especially with the mental health needs of our children and my husband's skyrocketing insurance deductible.
I am a foster care alumni via the Title IV-E Kinship Program. This funding made it possible for distant but still connected family members to be able to take me in and care for me. Even a partial connection to one's family of origin is incredibly impactful for young people and their developing brains and identities. I know I wouldn't be the woman I am today without the love and kindness my aunt and foster sister showed me.
Through no fault of their own, foster youth experience not only the abuse, neglect, and traumas from their family of origin, but they also experience many more from being bounced around through a broken child welfare system. Programs such as independent living programs or transitional age youth programs, HUD vouchers, SNAP funds, and the Pell Grants and Chafee education and training vouchers are instrumental in helping many foster youth aging out of the system have a fighting chance at making a life for themselves. I know firsthand because I wouldn't have made it to where I am now without some of these programs, which supported me at just the right moments after I aged out of the system. These programs, services, and departments are essential for our healing and for moving from trauma through surviving and into thriving.
I joined AmeriCorps to find a job where I could make a difference, learn new skills, and connect with others with similar backgrounds. I have gained invaluable experience in accounting and learned how organizations operate from the inside. It's been incredibly fulfilling to help current and former foster youth. AmeriCorps has profoundly impacted my life, allowing me to meet amazing people and gain skills that will benefit me in my future career.
After aging out of foster care at 18 without family support, social services like Chafee and Medicaid have been instrumental. They supported me in pursuing my education and managing my chronic illness. Now, at 22, I work full-time and plan to further my education for better job benefits. Cutting budgets for programs like Title IV-B could severely impact.
Foster care is hard on all of us. The kids, the caretakers, and our communities. Please don't cut funding. That will hurt some of our most vulnerable kids.